This minimalist wants more. The Enough-ism Podcast is about having enough already with what you have and where you are right now. Through conversations on meditation, mindfulness, and minimalism, learn how simplifying your life can lead to profound personal transformation. And now, on to today's guest.
Babies don't need toys for the first 2 or 3 months. There's just so little that you truly need. The joke that I make a lot is I can tell you the most effective tool for your baby's development is something that we all have, and it's free, and it's the floor. It's the floor. You just put your baby on the floor.
Meet Knell Spaeth, owner of Be Well Baby PDX, and a doctor of physical therapy and international board-certified lactation consultant specializing in pelvic health and neonatal physical therapy. With a background in bodywork and yoga, Emily brings a holistic approach to perinatal care. Today we're talking about mindfulness when it comes to being a new mom and how less is more when it comes to pregnancy. For example, the $1,700 snoo.
The best place for your baby is near you. It's not in some machine that's going to vibrate it back to sleep when it cries. We want to teach our babies that when they cry, we respond to them, to their needs. And that is so much simpler than buying all of these different things to help your baby sleep.
This minimalist philosophy shifts the focus from stuff to support, helping families prioritize what truly matters.
Hi, I'm Knell Spaeth, and I help families through the most tender and beautiful and transformative time in their lives, mostly around pregnancy, birth, baby, and postpartum.
Welcome to Enough-ism, Emily. It's so nice to have you here.
Thank you for having me.
You're welcome. I am really excited to talk to you because you set up this really fascinating intersection of birth and mindfulness and the journey of having a child and the mental preparation that entails. Talk to me about that intersection and the work that you do to ensure the journey of becoming a mother is essentially about less, not always about more.
I love this because the people that I work with are people who want more in terms of their birth preparation. They want more knowledge, they want more support, but we talk so much about having less stuff and more support. One thing that tends to come up with my clients is I support people for 6 months at a time, generally. One of the things that comes up a lot is, what do I need for this baby? And need is really relative. A lot of parents need sleep. There's an expectation setting moment where we talk about how newborns don't sleep through the night. They shouldn't. Biologically, that's not appropriate for a newborn. And there's a lot of shifting of expectations throughout our time together. But we tend to spend a lot of time talking about stuff, all the stuff that you're marketed as a new parent.
Yeah, tell me about all that stuff. I know you used the word expectation too, which kind of stood out for me. People have an expectation to have everything be the way it's supposed to be, maybe.
They want to have a Pinterest-worthy nursery for their newborn, and they want to have time to enjoy preparing for their baby. And the one thing that we know for sure about birth is that we can't predict how it's going to go. We don't know. We don't know what's going to happen with your baby's feeding journey. And we don't know what's going to happen with your baby's development. We don't know what your body's going to look like postpartum and how best to support you until we get there. And those are things that are put on the back burner in place of the right crib and the nursery colors and the right toys and all of the containers that we like to put babies in to make our lives a little bit simpler. Like you said, the stuff tends to actually lead to more complications. I see so many babies who have slept in a snoo, for example, who end up with a flat side on their head because they've been kept in one position all night. And babies are meant to move around. Babies are meant to eat in the middle of the night. And keeping them from doing that is not necessarily the most appropriate thing for their development.
Yeah, and does a snoo restrict the baby's movement when it's sleeping?
Yeah, so this is not like a hit piece on snooze, but one of the things that it does is it recommends that you swaddle the baby with their arms straight down. And I would never, ever recommend that you do that. It really affects the baby's nerve development and muscular development. They're meant to gently come out of that really flexed up position in a little baby ball. They're meant to come out of that position naturally with gravity, not forcefully with a swaddle. So that's the first thing that I don't love. And it really restricts the baby's ability to bring their hands to midline, to their face, and to their mouth. And those are all tools that the baby has to soothe themselves. So they don't get to learn those skills until they're out of a snoo. And it tends to delay development and lead to a head turn preference, which is the precursor to torticollis, which is just a tight neck. Basically, it means they prefer to look one way than the other. The muscles on one side have gotten tighter, and it's just a complicated diagnosis that you have to undo. Whereas if they weren't in a restricted position like that for so long, then it wouldn't be something that you have to spend all this money to hire me to come and undo for you. That's just one very brief example of how spending more money doesn't necessarily get you the outcome that you're hoping for.
I bring that up because it's something that's essentially harming your baby. And of course, someone might not know that. They might just think that's what you're supposed to do or it's what you're supposed to buy. And how does that kind of manifest in other ways?
I see a lot of families who look me in the eye and say, I can't not sleep. I need to sleep. I know that about myself. And one of the ways that I try to help shift expectations there is that you don't know what you're going to be like postpartum. You don't know what your baby will be like. Maybe they'll have a personality that allows you to sleep all the time. But likely the hormone shifts in your body, the way that our biology is designed to keep our species alive, it really doesn't matter as much. You are sleep deprived, but you don't feel it in the same way that you would before your baby arrives. It's just different. And I just yesterday had a family who I had taught prenatally. I saw them 4 days after their baby was born, and they're both just beaming, talking about how they haven't slept at all, and it doesn't matter. I was right. And it was just the most beautiful confirmation of, yes, it doesn't matter in those moments. And even if you have the snoo, it might be the place that you put your clean laundry because the best place for your baby is near you. It's not in some machine that's going to vibrate it back to sleep when it cries. We want to teach our babies that when they cry, we respond to them. And when they cry, they have an adult that's trusted, that is there, that is going to respond to their needs. And that is so much simpler than buying all of these different things to help your baby sleep.
You don't know what's going to happen after you have a baby in terms of your mental health and your sleep and all the different details. And how do you see that kind of affecting new mothers?
It's such a complicated question, right? Because there's so much that families are anticipating. And some families have spent years and years anticipating the arrival of their first baby. They've been through years of IVF. They've maybe ended up using a surrogate, or they've gone through so much to get to where they are right now. And that you think that you've been through so much, it must be enough to just be here. But there's so much knowledge that you could gain that can prepare you for the plethora of things that could possibly happen. Your baby could have trouble latching. Your milk could have trouble coming in because your baby came a little bit early. You could have a baby who comes out with a head turn preference. Most babies don't start out with getting a flat head because they're put on their back to sleep. Usually, it's from the way they grew inside the womb, which is hard to undo. It takes effort and time and intentional touch and an expert in baby movement, right? But if there's no knowledge that could even happen, then it can get delayed and delayed to receive care for something like that. Now, I've worked with families who, like you said, they don't know what they don't know, and they have a baby who cries all day long and just keeps crying and isn't eating very well. But they don't know. Maybe babies just cry this much. And it turns out that when I finally get there, because they're like, something doesn't feel quite right, they've been told over and over again, yeah, babies cry. Because in the doctor's office with the bright lights, the baby wasn't crying. And so their physician was like, looks like a baby. But then they go back home and the baby's still crying. And over time, parents can be told that things seem okay and things seem okay. And they'll be told not to trust their instincts. And that can be really hard as a first time parent because a lot of what I do in my prenatal cohorts, at least, is really focus in on trusting your intuition because like I said before, your biology is designed to keep you and your baby safe. Your brain is rewiring to make sure that your focus is on your baby. So there's no better time to trust your intuition. This is the time to trust yourself. A lot of first-time parents especially are hesitant to trust themselves because they want an expert to tell them that it's okay. But those babies who are just crying constantly, that's not normal, and there is a reason for it. Just telling someone they have a colicky baby doesn't get to the heart of the reason.
Thank you for sharing that. So tell me more. What do you need when you are preparing to have a baby? What do you notice people yearning for versus what you believe would best serve them?
Mm. I notice that my clients are looking for someone to hear them and to truly answer their questions. And they're looking for just the baseline knowledge of what might come. So many times I've had clients who go into their birth thinking that they're going to have just a vaginal delivery, no interventions, but something happens and they need an induction. And they've never even heard the word induction. So being able to move through this time in your life as if it's a new level of education for you and your family is so important. I wish that this was part of high school education. A lot of the people that I ask in retrospect just wish that they had more knowledge and less stuff.
Especially because getting any kind of medical information or diagnosis, or you have this, or you are this, if someone hears you are diabetic, whatever it is, that can be very emotional. And if you all of a sudden have this health issue with your birth or something has to be solved, but you've never even heard the terminology and you don't even know what that means, I can imagine that must be really hard.
A lot of the time, really, all people want is to be able to enjoy their pregnancy. And then they're hit with something like hyperemesis gravidarum, where they just throw up for their whole pregnancy. It's horrible. And so, really, what you need is support. And I just became part of this awesome organization called Be Her Village. And it's essentially that. It's like it's a registry for support people. So for doulas, for lactation consultants, for physical therapy, for yoga, all of the things that you want to know and do and be during your pregnancy that aren't the things that you're going to accumulate over time. It's a really wonderful organization.
And you work with them just to help offer new kinds of support.
Yeah. So I'm basically an item that you can register for, and you just ask your friends and family to contribute to your fund for working with me if you add me to your registry.
It seems from the way you describe your role and your work that you're kind of like the springboard between uncertainty and fear and needing to navigate the unknown to like coming through to the other side as this like beacon of support. Can you talk about what that feels like to bring people to the other side as you're supporting them? Because I'm sure you've encountered many experiences where it's someone's first time going through something, but you've seen it before. so you can help them through your knowledge and having experienced it through other people in different ways.
Oh my gosh. Yes. I've seen it so many times, time and time again. One of the reasons I started offering my support prenatally was I just kept seeing the same things and kept hearing the same things I wish I had known before baby arrived. I wish I had known everything. And I run a postpartum support group that meets in person, and people will come at around 3 or 4 weeks postpartum and bring their tiny babies. And inevitably, those are the mamas that end up in tears and are just struggling and having the hardest time. And inevitably, there's a mom in that room who has a aspect of their story that is very similar. I had one group where my group meets in a birthing center. And so a lot of the moms who come to my group attempted to have their babies in that birthing center. But I had one group of about 7 moms, and we had a new mom sharing her story. She cried, and she had to transfer from the birthing center to a hospital, and it was awful. And when you plan to have a baby in a birthing center, the last thing that you imagine or want to happen is transferring to the hospital. And so you can imagine this room of moms just feeling for her. And then one of the moms said, I transferred too. And then every single other mom in the room said, me too. Oh, it was so powerful. And she was like, really? I'm not alone. And so to see that mom then come every week and be the beacon of hope and support a couple months down the line for the next mom is just such a beautiful, like, cyclical nature of what I do. It's one of my favorite parts. I've also seen a lot of people in their pregnancies at this point and supported them from usually they find me because they're in pain. That's the first step. And we work through the physical pain. But so much of the time, it starts with their posture and how they have patterned their bodies throughout time. Pregnancy just exacerbates anything in your body that's already there.
So pregnancy exacerbates everything in your body that was already there.
I have seen time and time again how just this added amount of weight on your body over time each day exacerbates the small little tweaky parts of your body that don't feel great. Your chronic pain, because your body is changing literally every single day. Your center of gravity is shifting forward every day, and your body has to compensate. But it has patterns that it's used for your whole life up until now, and it will continue to use those patterns, sometimes to your detriment, unless they're addressed in pregnancy. And pregnancy is such a cool time in your body. There's so much changing that there's this window into an ability to transform your body. So that's one of the reasons I love to work with people in pregnancy. But most of the time, they find me because that chronic pain has gotten worse or flared up. And we just work on the patterns. And ultimately, we end up working towards breath and changing the breath.
How do you find that helping people focus on their breath and grounding themselves and centering themselves, how do you feel that kind of gets them to a new body or an evolving body where it's no longer theirs, but it is theirs? It just feels different.
Yeah, we always ask the question, who is she of this new body? Or who are they? And I think that there's an incredible transformation that happens up until birth. Birth is an amazing transformation. And then postpartum is wild as your body finds its way back to homeostasis. And I love to support people as they're going through this journey. Breath is huge. We need breath, but it's an incredible tool. I think anyone who's seen someone give birth in the movies has seen people doing the like big Lamaze breathing. Like breathing is something that you're supposed to do when you're in labor, but there are really easy ways to trust your body's ability to breathe and just enhance what it's already doing. So I do a lot of that with my clients, and I do a lot of meditation and helping them to focus in on their breath in a functional way. So we look at how they're breathing and we try to together be little detectives and figure out the most efficient way for them to create more space in the places that they're not getting enough breath. So usually it's into the back of the body or maybe the sides of the body. We want to create as much space as possible in the rib cage because the baby is taking up the abdomen.
The way that you breathe is different than before.
Feels different, but your whole body has to adapt. And it's really, I love to work with people in pregnancy because we can make so much change in their bodies, in the habits that they're using, in the strength that they have in order to make birth easier. And I would argue that kind of work, focusing on your body, taking time for yourself, going inward, trusting your intuition, moving your body in a way that makes things more functional, makes your life less painful and makes birth easier and recovery easier. That is way more important than anything that you could buy that's tangible. Babies don't need toys for the first 2 or 3 months. There's just so little that you truly need. The joke that I make a lot is I can tell you the most effective tool for your baby's development is something that we all have, and it's free, and it's the floor. It's the floor. You just put your baby on the floor. Yeah.
What are your thoughts on, I live downtown in the city, and I very commonly will see parents pushing their baby in a stroller through a beautiful park, and the baby's just on the iPad, on the phone, and you can just see the glaze over the baby's eyes. And I've seen the opposite, where the baby's walking through the park and they're just looking at everything. Their eyes are lit up, and it's like such a different processing happening in the brain. What are your thoughts on that? Like just how society is shifting and there's just way too much screen time and too much addiction too early.
I think we need to do a whole nother episode on that topic.
Yeah.
My short version is that especially newborns need time outside for their vision to develop appropriately, if nothing else. They need to be able to see long distances. And one of the best ways to calm a crying newborn who will not calm is to take them outside so that they can look at the trees and smell the fresh air.
I think that in a way sums up everything we've talked about. It's like it really is that simple, is do less to do more.
Yeah. And when you're thinking about your baby's development, you can also do less. With enough education, you can set up your environment so that your baby will learn to play independently and they will do all of the work that they need to. You don't need all the apps. You don't need all the tummy time tools. You just need the right environment so that your baby will do what they're biologically meant to do.
Thank you so much, Emily. I really appreciate it. I will drop in the show notes information on where to find you and where to learn more about you. Thank you so much.
Thank you. It was my absolute pleasure to be here and talk to you today.
You've reached the end of the Enough-ism Podcast. I'm your host, Reverend Yugen Bond, and you can reach me anytime at enoughisompodcast@gmail.com. We've chosen to embrace simplicity with no social media presence because sometimes less truly is more. If you enjoyed our chat today, like, subscribe, and share to help others discover the beauty of living with enough and to be notified whenever a new episode goes live. Thanks so much. And remember, you are enough right now with everything you have and everything you are.